A phrase that sticks out to me is "nothing about us without us." So I find that as a person with lived experience, you're not going to get the results you want without including us throughout the whole process.
To do research, you have to be passionate about it. Research is not easy. My passion comes from the fact that my father died of prostate cancer and my favourite uncle. And so I'm very cognizant of my research actually making a real difference and helping patients, people directly. And that's why I think involvement of consumers is so important, because you need to answer the questions that are important to them, not the questions that are important to me.
The Consumer and Community Involvement Program brings together our universities, medical research institutes, hospitals and health service providers, and the research that's done in those places, and connects it with people in our community with lived experience and consumers in our health system to put involvement into research.
Working with a consumer advocate has made the process seamless for us. It's made it more efficient, more effective, and really has opened our eyes to how we can get more of our consumers involved in our research.
I would say to any researcher who's thinking about involving consumers and hasn't actually done it before, that you should just go for it. Find an organisation or find a group of people and ask them what they want and how they can be involved, because consumers want to be involved and sometimes they don't know how to, so it's good to use programs such as this program to try and connect the dots there.
It was about a week after Riley died that we decided to get involved in research. We were desperate to make some kind of meaningful change to find a positive in his death. I really noticed that the WA researchers who have been engaged with the Consumer and Community Involvement Program have all the tools and training and skills to involve us in a very meaningful way, and not just a sort of ticking the box.
My involvement with the program has been through the Telethon Kids Institute, and they have really helped us to build links and connections with consumers.
Without that network of consumers, we wouldn't have any trials, we wouldn't have any research, because we wouldn't have any participants. And so they're absolutely critical to the successful conduct of our entire research program.
Our priorities as researchers and scientists and clinicians are not always the same priorities of the community.
You know, we think we're all very practical people and logical, but they always come up with extra things that has just been so invaluable to the projects that we're running.
And we can help to deliver better research outcomes. We can work with researchers and really improve the quality of research that is being conducted.
Everyone can experience making a difference in research. It's easier than you think, so get in touch with the CCI program today.